This is the lecture on Chapter 15, which is on psychological disorders. I think this is often the most interesting part of psychology that people like. They tend to want to know a lot about the disorders. And so hopefully you'll find this interesting. We're just going to go through several classes of disorders and discuss those briefly. So first, let's define psychological disorders. Keep in mind that psychology is the study of behavior and mental processes. It's the study of how our behavior and our thinking and the way we feel is all connected. So psychological disorders are connected with severe mental distress and impairment in day-to-day functioning. But let's define this in more detail. Someone may be diagnosed with a psychological disorder when he or she meets a combination of the following criteria. First, their behavior and mental processes, the way they think and feel, are unusual and outside the norm of how the majority of people would feel and act in that similar situation. They have a faulty view of reality, such as hallucinations or delusions. They're under severe personal distress. They are self-defeating, which means that their behavior and the way they think and the way they feel doesn't lead to a better life. It doesn't lead to a better, higher quality of life. It leads to a lower quality of life. They're dangerous to themselves or others. This is obviously something that you really have to pay attention to. And their behavior is socially unacceptable. It's just not behavior that the majority of people would perform. However, just a little caveat to that, it's important to consider the person's culture and ethnicity because some behaviors in one culture may be acceptable and unacceptable in another culture. So just a little note of something to take into account. Let's start out with schizophrenia. Schizophrenia is a psychotic disorder characterized by significant disturbances in the way you think, the way you feel, specifically with problems of perception, including hallucinations, which we know hallucinations are usually seeing or hearing things that aren't really there. Usually becomes evident in young adulthood, the early 20s usually, and it's lifelong. It does last a lifetime. Symptoms can be positive or negative. Positive symptoms include inappropriate behavior, such as delusions and hallucinations. Delusions are beliefs that do not correspond with reality. And again, hallucinations are when someone perhaps sees or hears things that really aren't there. Negative symptoms reflect the absence of appropriate behavior, such as lack of emotion, appearing very blank, even physically motionless. A couple types of schizophrenia. There's the paranoid type, which they often have very complex delusions and hallucinations. For example, someone might believe that they're being targeted by a gang and hear voices confirming this belief. So there's this delusion that they're being searched out by a gang, and then they hear voices that tell them this belief is true. The disorganized type, this person will have very disorganized thoughts, speech, and behavior. The emotions they display are also disorganized and don't correspond with their current environment. The emotions they display, in other words, don't match what's going on in their environment. The catatonic type is a severe impairment in motor activity. They may stay in the same position for hours and usually aren't speaking. So that's schizophrenia. Let's move on to mood disorders. Major depressive disorder, which is probably one of the most common disorders we hear about, is a severe experience of depression. Could include appetite changes, an inability to concentrate, loss of interest in activities once enjoyed. I think that's one of the primary markers of depression is just this loss of interest in everything that you used to enjoy. Could affect your sleep, and there could be a decrease in personal hygiene. Bipolar disorder, which used to be called manic depression, that person cycles between feelings of elation or mania, that's where that word comes from, and depression. So they go through periods of mania and then periods of depression. We know what the period of depression looks like, but during the manic part of the cycle, the person may have excess energy, they don't need sleep, they take part in dangerous activities, and they may talk really fast. Those are just some examples of the symptoms of bipolar disorder. Anxiety disorders are also pretty well known. Phobias, a phobic disorder, is an extreme and irrational fear of specific objects or situations. Panic disorder is an anxiety attack that doesn't appear to be related to anything in the person's current situation and environment. In other words, there doesn't really appear to be anything in the environment that for the majority of people would create anxiety, but for this person it does. Generalized anxiety disorder is similar, but it's persistent anxiety. It's not a limited amount of time like an anxiety attack. It's persistent anxiety that also doesn't really seem to correspond with their situation. Obsessive compulsive disorder obviously consists of obsessions, which is an unwanted thought, word, phrase, or image that persistently and repeatedly comes into a person's mind and causes distress. And then the compulsions are repetitive behavior performed in response to uncontrollable urges or according to a ritualistic set of rules. The compulsions are usually performed in an effort to get rid of the obsessions. Stress disorders. Post-traumatic stress disorder is feelings of anxiety related to a past traumatic event. We think of this most often, I believe, as veterans who have been in combat having PTSD. It could also be due to a violent attack or a history of abuse, a natural disaster, being involved in a hurricane. And it doesn't have to occur immediately after the event. It can occur 6 months or more after the traumatic event, and it tends to be ongoing. It tends to last. On the other hand, acute stress disorder has to occur at least 1 month after the traumatic event, and it only lasts for 2 days to 4 weeks. It's very short. It doesn't really last ongoing. Some dissociative disorders. Dissociative amnesia is a person who is suddenly unable to recall important personal information, and it has to be unrelated to a medical issue. For example, if someone has a stroke and then they're confused and unable to recall information, that wouldn't be considered dissociative amnesia because it's related to a medical issue. Dissociative fugue, a person who abruptly leaves their home and moves to another place. They don't recall their past life. They just start all over again in a sense. And dissociative identity disorder, which used to be called multiple personality disorder, is a person who has 2 or sometimes more separate personalities or identities. The textbook indicates that each identity may or may not be aware of the others or of events experienced by the others. Personality disorders, I'm not going to go over all the personality disorders because there are several. Feel free to look at your book if you'd like to see a list of all of them. But paranoid personality disorder is an odd, eccentric personality disorder characterized by extreme suspicions and mistrust of others in unwarranted and maladaptive ways. Schizotypal personality disorder is also an odd, eccentric personality disorder characterized by a desire to live in an isolated and asocial life, but also by the experience of odd thoughts and beliefs. It's not the same as schizophrenia because there aren't any delusions or hallucinations. It's more just an odd way of thinking. Schizoid personality disorder, this person is also probably a loner and not interested in creating relationships with others and displays very little emotion. Also, there's no delusions or hallucinations, though, like schizophrenia. Borderline personality disorder is characterized by out-of-control emotions, fear of being abandoned, going back and forth between idealizing and despising people who are close to them. Antisocial personality disorder, these people are often charming and very intelligent. However, they don't have any interest in creating a real relationship with other people, and they really have a lack of empathy for other people. The majority of serial killers are usually antisocial personalities. If you know anything about serial killers, they're usually very charming to lure their victims, but they really don't have any desire to have a relationship or have empathy. Finally, avoidant personality disorder. Often they are also loners and don't have many close relationships. Unlike the ones we mentioned earlier, though, they want close relationships. They don't prefer to be a loner, but they fear rejection and criticism, which is why they don't have a lot of close relationships. So that's it for a lot of the disorders. As usual, there's much more in your book about each of these disorders, so feel free to look at that, or if you have any specific questions about any of them, feel free to ask me.